to the clinic today?
Yeah, I've had a sore throat, and my son was diagnosed with strep throat. So
I'm sorry to hear that.
thank you.
Can you tell me where it hurts?
Just right in this area.
Just right in your throat.
Yeah.
Okay. And when did the pain start?
Probably 2 days ago.
Okay, so symptoms started 2 days ago.
Mm-hmm.
Okay, and then during that time, is it a constant pain or does it kind of come and go?
It's constant.
Okay.
It's always kind of there.
Okay, and then how would you describe that pain?
Like a sharp pain.
Okay.
Yeah.
Is there anything that makes it better?
I've taken like ibuprofen. That might help a little bit.
That helps a little bit.
Mm-hmm.
Okay, good. Is there anything that makes it worse?
Just like when I swallow, if I'm eating or drinking something.
Okay. And does the pain radiate anywhere? Is it just pretty much in the throat?
Yeah, it's pretty much just right in there.
Okay. And then as far as the pain, is there a time of a day that it seems like it's better or worse?
Like it gets worse at night.
Okay. And then on a scale of 1 to 10, 10 being the worst pain you've ever had, 1 being hardly any pain at all, how would you rate the pain?
Probably like a 6 or 7.
Okay, good. And so now I'm just going to kind of go over a review of systems and just ask you a bunch of questions, and you can just answer them yes or no, okay?
Sure.
All right. Have you had any chest pain?
No, not really, no.
Okay. Heart palpitations?
Mm-mm.
Shortness of breath?
No, ma'am.
Pain with breathing?
Mm-mm.
Cough?
No, ma'am.
Okay. Any nausea, vomiting, diarrhea, constipation?
No.
Urinary frequency?
Mm-mm.
Pain with urination or incontinence?
Mm-mm.
Any rashes or skin lesions?
No.
Any dizziness, headache, loss of consciousness?
No.
Difficulty thinking?
Mm-mm.
Change in mood?
No.
Okay. Any joint pain?
Mm-mm.
Any body aches or
Mm-mm.
chills?
Yeah, maybe a few.
Some body aches and chills with this?
Yeah, maybe a few, yeah.
Okay, perfect. Thank you. So now I'm going to get a little bit of your medical history. Is there anything that you've been diagnosed with? Any medical problems?
I have not. No.
Okay, good. Have you ever had any surgeries?
I have. I had a appendectomy.
Do you know when that was?
I was a kid, like 2001.
Okay. Any complications with that surgery?
I think it went well.
Okay, good. Anything else?
I had my wisdom teeth taken out.
Okay. When was that? Do you
Probably
remember?
like 2011.
Okay. Any complications with that procedure?
No, it was great.
Okay, great. Are you allergic to any medicine?
Not that I know of.
Okay, good. And as far as your family goes, is there any history of cancer?
No.
High blood pressure?
Yes.
A little bit of family history of high blood
Yeah.
pressure? Okay.
Yeah.
High cholesterol?
Mm-mm.
Diabetes?
Mm-mm.
Thyroid issues?
No.
Okay, great. And then do you drink alcohol?
Seldom. Like maybe a couple drinks on the weekend or something like that.
How many drinks would you say on average a week?
2 to 6.
Okay. Any history of smoking cigarettes?
Mm-mm.
Tobacco use?
Long time ago.
Okay.
I did in high school.
Okay. For about how long?
I started
year,
in high
2
school,
years?
probably, yeah, a couple years.
Okay. And was this daily?
Pretty much.
Or maybe every other day?
Pretty much, I mean, yeah.
Okay. Any recreational drug use?
Mm-mm.
Okay. And do you take any medications daily?
Mm-mm.
Do you take any over-the-counters? I know you said ibuprofen.
Just because.
Just ibuprofen as
Yeah,
needed for
yeah,
pain?
Yeah.
Okay, great. All right, well, we are going to start the exam now, if that's okay with you.
Yeah, sure.
But I will say I did notice when the patient entered the room, he had a strong, good gait. His posture was well. He was balanced. The patient is well groomed, clean. He seems to be in a good mood and calm. And yeah, so all that looked well. And he was well balanced as well. Okay, so now I'm going to just start at your ears.
Alright.
Is that okay?
Sure.
Alright. So upon looking at your ears, they are symmetric to the face. No erythema or lesions noted. No masses. No drainage or earwax noted. Now I'm going to just look inside your ear, okay?
Alright.
I'm going to pull the pinna up and back. And the tympanic membrane is gray and pearly. No erythema noted, no drainage. The cone of light is at 7 o'clock, and the handle of malice is visible. Go to this side now. Again, pulling the pinna up and back. And the tympanic membrane is pearly gray. And again, no erythema noted, no drainage, no earwax. The cone of light is at 5 o'clock, and everything looked great. So now I'm going to do some hearing tests on you.
Alright.
So I'm going to close your ear, and I'm going to whisper a word and just tell me what you heard, okay?
Alright. Apple.
Okay, good.
Yeah.
Baseball.
Baseball.
Okay, good. You passed.
Thank you.
So now I'm going to take the tuning fork, and I'm going to place it on your midline upper forehead. And what I want to know is if you hear the sound of the vibrations the same on both ears.
Yeah.
Okay, good. And now I'm going to, and that was the Weber test. Now I'm going to do the Renna test, and I'm going to put the tuning fork on your mastoid bone, and then I'm going to place it in front of your ear, and you're just going to tell me where you hear it the loudest.
Okay.
In front of your ear?
For sure. The front.
Okay, and that's good. Air conduction is greater than bone conduction. So you passed, good job. And that is testing cranial nerve 8. So now we are gonna go to the eyes. And upon inspection, the eyes are symmetric. Eyes and eyebrows are symmetric to the face. No drooping, no erythema, no inflammation or drainage noted. Just gonna look into your pupils. They are round and equal. Now I'm just gonna have you look ahead, and I'm gonna look into your pupils for reaction to the light. Great. Again. So the pupils do constrict directly and consensually. Okay, and now I'm going to have you just look straight ahead. Now look at my finger and follow it. Very good, and the pupils constricted again. So his pupils are equal, round, reactive to light and accommodation, and they were about 3 millimeters in size. So now I'm gonna test your extraocular movements.
Alright.
So I'm gonna have you just watch my fingers, but keep your head steady, okay?
Okay.
Okay, great. Was there any blurred vision when we did that?
Mm-hmm.
Okay. No nystagmus was noted. So cranial nerves 3, 4, and 6 are intact. Now I'm going to look for your red reflex. So I'm just going to have you look forward and I'm going to shine the light in your eye, okay?
Alright.
One second, I got to change to my ophthalmoscope. Great. Okay, and the red reflex is present on the left eye and the right eye. So red reflex present bilaterally. Okay, great. So now I'm going to move on to your nose. The nose and septum is midline to the face, and the nasal mucosa and turbinates are light pink, no inflammation or erythema noted, no drainage or polyps. You can just take a breath in and out for me. Great. Other side, in and out. Okay, airway is patent. Now I'm going to have, I'm going to palpate your sinuses. So I'm going to start with the frontal. Any tenderness?
Mm-mm.
Okay, great. And then the maxillary. Any tenderness there?
Mm-mm.
Okay, great. Now I'm going to move to your mouth. Your lips are pink and moisturized. They don't look dry or cracked. I'm going to have you open your mouth. Your teeth, there seems to be no cavities, no cracks or missing teeth, no chipped teeth or dental caries. Your buccal mucosa is pink and moist. Lift your tongue up for me. Okay, no lesions noted, no inflammation. Stick your tongue out for me. The tongue is pink and midline, it's a little dry. So there is some xerostomia noted and slight halitosis. And the patient's speech has been well. So cranial nerve 12 is intact. Now I'm going to have you open your mouth and I'm going to look at the back of your mouth.
Alright.
Say ah. Okay. The uvula rose and fell appropriately. Now I'm going to check your gag reflex.
No.
Say ah. Sorry. Gag reflex is intact. So cranial nerve 9 and 10 are intact. Now I'm going to look at the back of your throat. Say ah. Okay, so the posterior pharyngeal wall is erythematous, but no inflammation or lesions noted back there. The tonsils are inflamed and erythematous, and there's exudate noted bilaterally, a grade of 2+. Sorry about that, never fun. Okay, moving on to your vision test.
Alright.
I'm going to stand back, 'cause this is a small card, just about 6 feet. So do you wear contacts or glasses? No? Okay, great. So I'll start right here. Can you read this line?
C.
Oh, I'm sorry. Close
Oh,
one
sorry.
eye with your hand. Thank you.
C. Is that one the C?
Yes.
C F D H J.
And this line.
L T F P H.
Perfect. Now swap to the other eye. Can you start right here?
L T F P H.
Perfect. Okay. So that was the Snellen chart with your visual acuity 20/20 bilaterally. It's a great job there. Now Oh, and that is cranial nerve 2. Now I'm going to move to test your masseter and temporal muscles. If you can just clench your jaw for me. Okay, and again. Okay, perfect. Strength is 5+ bilaterally and symmetrically. And then I'm going to have you close your eyes, and I'm just going to touch your face, and just let me know if anywhere the sensation feels different, okay? Did it feel different anywhere?
Mm-mm.
Okay, great. So the sensation was the same bilaterally. Cranial nerve 5 is intact. Now I'm going to feel for your TMJ for any crepitus. Just open your mouth for me. Okay, good. Close. Okay, no crepitus was felt. Was there any tenderness when I did that? Okay, great. So now I'm going to have you do a couple motions with your face. If you can raise your eyebrows for me, and then I'm going to pull up, and now I'll try to go down with your eyebrows. Pull down with your eyebrows. Perfect. Okay, now smile for me. Frown. And then puff your cheeks out. Okay, great job. Cranial nerve 7 is intact. Now I'm going to look at your neck. Your trachea is, just look straight forward for me. Your trachea is midline. No obvious deformities or masses noted. No bulging at the base of the neck. I'm going to palpate now. Any tenderness felt? Okay, and then if you could swallow for me, or tilt your head up just a hair. Perfect. And swallow for me. Okay, the trachea rose and fell appropriately. No masses or nodules felt. No quarters seen. Now I'm going to have you shrug your shoulders up against my resistance, testing your trapezius muscle. Great. Now I'm going to test your sternomastoid muscle. I'm going to push against your face, and then you resist. So push to the left. Okay, great. Push to the right. Great. So cranial nerve 11 is intact. Strength was great. 5+ bilaterally. Now I'm going to feel your lymph nodes for any inflammation or tenderness, starting with the pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, and infraclavicular. Okay, no inflammation noted. They were the appropriate size, and they moved freely. Did you feel any tenderness with any of that palpation anywhere? Can you show me? Okay.
Yeah, right in that area.
Okay, supraclavicular, which is pretty common with having a sore throat. Okay, that is it for the exam today. I think we need to take you to get a swab for a strep test. Sound good?
Yeah, thank you so much.
Thank
Appreciate
you for
it.
your time.
Yeah,
Be right back.
Thank you.